Hello everyone, and welcome back to the series of lectures. And at this moment we are going to take a higher notch, and we will be dealing with mostly physiotherapy. And maybe some people might not be having a good understanding of what is physiotherapy. So let me give a brief introduction about what is physiotherapy. So physiotherapy is a therapy medicine which involves treatment of movement-related disorders and probably disabilities with the aim of restoring normal movement, and which will assist people to do their activities of daily living. And physiotherapists use several modalities, which will include electrotherapy, hydrotherapy, amongst other modalities. And now in that connection, that's why we are today introducing the electrophysical agents, which are abbreviated as the EPA. So as from now, we will be dealing with the electrophysical agents, which there are several of them. So we will be dealing with each one of them to bring a better understanding of it and even to know how to use it. So welcome all. We will be having some learning objectives. So let me project the learning objectives for you so that we journey together. We will need to understand the definition of the modalities. We get the types, the production of the modalities as well, and we will be required to know how the treatment is administered using the modalities, and that is where we get to the point of dosage, as well as the indications, whereby these are the conditions which are prescribed or should be treated using certain modalities. That are the ones which are called indications, and contraindications are conditions which should not be managed or treated using the modalities. That's what we call the contraindication. So we will be still checking on the physiological effects as well, and the therapeutic effects, and we shall be handling equally the dangers. You know, each and everything that is being used, it must have some dangers of it, and it should even produce some effects. That's why we need to bring this in a good scope of it, so that we can understand, even as maybe we get in touch with them, so that we might understand what we are doing. So these electrophysical agents, or the EPA, we still need to have a general understanding of them, and even to know what are they used for. So we will still look at the general uses of this, but maybe to highlight for you, you must know that the electrophysical agents, they are used in pain management, in conditions like Achilles tendon tears or rupture, amongst other conditions, which I will project even as we continue. But before we go to the general uses, I would like us to know, what are these, the electrophysical agents, or what is the basic definition of it. And we get to know that these are modalities which are used in physiotherapy to apply thermal, mechanical, electrical, or light energy to patients, aiming to achieve therapeutic benefits such as pain relief, and improve healing. And when we talk about improving healing, we should be able to explain how do they improve healing. And maybe to mention is that most of these electrophysical agents, but we need to exclude some few, they improve the blood flow to the affected area, which will be significant to the process of wound healing. So that is what basically the electrophysical agents are. I think now we are in a better ground to explain what are these electrophysical agents. So let us look at the general uses of these electrophysical agents. And as I had mentioned some few seconds ago, is that these electrophysical agents are used in management of several conditions, and we find that they are used in management of pain, in management of sprain and strains, yeah, in management of the Achilles tendon rupture. Of course, there is the lateral epicondylitis or the tennis elbow, and we will again have the ACL and PCL tear. This is the anterior cruciate ligament and posterior cruciate ligament tear, and when we view this anatomically, we find that these ligaments are found around the knee area. So these electrophysical agents are used in management of bursitis, which is the inflammation of the bursa, which is the sheath covering the bones. And we still have that they are used in management of joint stiffness. You find that the joint is so stiff, and by the joint being stiff, thereby the range of motion will be reduced. So we need to administer treatment to joint stiffness so that we increase the range of motion. And we still be handling the muscle spasms. Yeah, so those are some of the uses of the electrophysical agents that we shall be looking at individual level of the electrophysical agents. So maybe it could be good if we get to know what are those electrophysical agents, or else what are the example. So we find that there are still therapeutic ultrasound. Yeah, let me project for you the slide with the examples of these electrophysical agents. So we have the therapeutic ultrasound, the transcutaneous electrical nerve stimulation, which is the TENS. And maybe to give a brief explanation, therapeutic ultrasound uses some sound waves to administer the treatment. And the transcutaneous electrical nerve stimulation, or else the TENS, uses some electric current, as even it appears from its name. We have the cryotherapy, which is also known as the ice therapy, simply the use of ice. And there is the interferential current therapy, or else the IFT, which is mainly used in management of pain or else modulation of pain. And it uses just some high frequencies. There are two oscillators producing high frequency currents, which range from 2000 to 5000 hertz, and these frequencies need to be slightly different, so that when they are applied simultaneously, then they will produce a beat frequency, and this beat frequency is the one which is used to administer the therapy or treatment. We have moist heat therapy, as well as the infrared and laser therapy. So basically these are what we will be handling. So we will be dealing with each electrophysical agent. We check on the types, how is it produced, their dosage, yeah, their therapeutic effects, physiological effects, their dangers. Yeah, we will be dealing with each and everything in the individual electrophysical agents. So I would like to welcome us. This was basically an introductory lecture, just to get the overview of the electrophysical agents. So I welcome us all so that we journey together when as we get to understand what are these electrophysical agents. Thank you.